Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our sessions in basic emergency care course. This session is about shock. Objectives of this session to recognize signs of shock and poor perfusion, perform critical action for patient with shock, how to assess fluid status, select appropriate fluid administration based on patient age, weight, and condition, recognize malnutrition, anemia, burn, and adjust fluid resuscitation accordingly. In order to manage patients with shock, you need to master certain skills. Don't forget skills for airway management. You need oxygen administration, IV line placement, how to assess fluid status, fluid resuscitation, what to choose and how to give, assess patient with burn and burn management, needle decompression, three-sided dressing, bleeding control, uterine massage, and trauma secondary survey. First, let us define shock. Shock is tissue hypoperfusion, poor perfusion. The body is not able to get enough oxygen so that these organs cannot carry their function in a normal way. Uncontrolled poor perfusion, when there is a hypoperfusion, the organ stop working properly. And if it is prolonged, then the cell will die. Infant and elderly are more subjected to shock. Shock can be, hypoperfusion is assessed in three organs in the brain by altered mental status, and it can progress even to coma, altered mental status, irritability, confusion, and also by low urine output, and in the skin by cold, clammy, and mottled skin. There are four major causes of shock. First one is hypovolemia, which is the commonest. Hypovolemia could be due to blood loss, and then it is termed hemorrhagic shock. It could be due to fluid loss, like in vomiting, diarrhea, excessive burn, and excessive urination, as in diabetic ketoacidosis, and also due to poor fluid intake, as in dehydration. Distributive shock, this is because of abnormal relaxation and enlargement of blood vessels, as seen in sepsis, spinal cord injury, and in anaphylaxis. Obstructive shock, which lead to poor heart filling, as seen in pulmonary embolism, tension pneumothorax, and cardiac tamponade. And also it could be related to poor cardiac function, poor pump function, as in cardiogenic shock. The goal of initial assessment is to identify shock, to recognize there is shock, and to find if there is any reversible factor. The goal of acute management is to restore perfusion by maintaining volume status and also by maintaining hemoglobin, because this is the vehicle that carry oxygen to the tissue. And whenever there is ongoing blood loss or fluid loss, you need to address that and to stop it if possible. After you do the ABCD approach and manage life-threatening condition, as we mentioned in the first session, then you need to do secondary survey, and that by doing sample history and secondary exam. In sample history, you want to look for symptom and signs that can give you clue about certain disease, allergies that can precipitate shock, medication that can precipitate shock or give you clue about underlying medical condition, past medical history, and the last time did the patient take, have oral intake, and surrounding events surrounding the illness. Signs and symptoms, you need to see if the patient has been vomiting or having diarrhea, the amount and how long he has it, because this can give you clue about the volume status and it can help you with resuscitation. You need to know if there is blood loss, uh, vomiting, hematemesis. It could be fresh blood. It could be altered blood because of digestion. That could be coffee ground, and blood also can come through the rectum. Hematochezia or melena, that is altered blood. Patient can bleed outside, or uh, GI bleeding can be concealed. It could be in the stomach and intestine, and patient just show manifestation of shock. Bleeding can happen from the genital tract. You need to ask if the lady is pregnant, and when was the last menstrual period, any missed cycle, and if she's postpartum, so the lady can have a antepartum or intrapartum or postpartum bleeding, and sometime during early period of pregnancy they can bleed from ectopic pregnancy. So always in ladies at the conceptual age consider pregnancy. And patient with shock and who has a history of chest pain, this could be an MI, myocardial infarction, and cardiogenic shock due to damage of cardiac muscle. When there is fever or any feature of infection, this could be sepsis and septic shock, which is distributive shock. And where was there any exposure to toxin, medication, insect sting, because this can lead to anaphylaxis and distributive shock. Drug overdose can also precipitate that and can lead to, especially the blood pressure and seizure medication can cause overdose, can lead to shock. In patient, if there any altered mental status, if there unusual sleepiness, as we mentioned, brain is the one of the organs that you can see the tissue hypoperfusion. If the brain does not get enough oxygen, it will not function well. So altered mental state in form of irritability, confusion, stupor or coma could be feature of shock. And whenever you are thinking ABCD, always consider hypoxia, shock, then consider hypoglycemia, and then other causes. Allergy, if the patient has certain allergies, if he get exposed to those allergens, then he can develop distributive shock and anaphylaxis. Severe allergic reaction can lead to shock, causing abnormal because of abnormal relaxation of the blood vessels. Medication, what are the current medication? Any new medication? Medication can precipitate allergy, or patient can take overdose by mistake, or it could be suicide. Ask for past medical history. It can give you clues: history of diabetes with polyuria, then volume depletion and DKA. Pregnancy, because lady can have antepartum, intrapartum, postpartum, or even ectopic pregnancy, rupture of ectopic pregnancy. Recent surgery, patient can bleed, and history of heart disease can develop cardiogenic shock. HIV, it can increase the risk of infection. You ask when was the last time did the patient take orally. Some people who are in difficult situation could have dehydration, but also when you want to do intervention, last oral intake can affect your decision. You need to know about situation surrounding the illness. Was there any trauma? Because it can figure or point to internal bleeding, tension pneumothorax, cardiac tamponade, and also trauma to the neck can lead to a spinal shock because of injury to the spinal cord. And recent illness like any infection could lead to sepsis. So patient with shock, after you do the primary survey, you assess and manage airway, breathing, and circulation. You do the secondary survey. In the secondary survey, in the sample history, sign and symptoms, allergy, medication, past medical history, last oral intake, and events surrounding the illness. All these can give you clue so that you can figure out the cause of shock and administer appropriate management. Thank you. We see you in the next session.